the 15th of October. Now, it appears that cases in the States are going down, apparently due to herd immunity, but in the UK we're not seeing this. It's quite difficult to explain, really. But let's have a look at some orientation slides first of all before we go on to that. So here we have the new daily confirmed cases, as we often look at. New Zealand at the bottom there, a few. Australia going up. Technically, Australia's got slightly more than Canada at the moment. You can probably see there the green line is Australia. Moving up to the Netherlands, where we've got a bit of an increase. It seems Europe's getting a bit of an increase. And we see that again in Ireland, where there's been a bit of an increase. But the United States going down nicely, as we've just mentioned. And the UK, well, in terms of pure cases there, really the less said the better. It's the cases are still surging ahead in the UK. Now, what really matters, of course, is the number of COVID patients in hospital per million. This is the real thing that matters. It doesn't matter if people get a little bit ill or a little bit of a cold. Not too big of a problem. But Netherlands we see lowest. Then Canada. And then Ireland. But Ireland with a slight upward trend. UK really sort of, you'd have to say, levelish to slightly increasing in hospitalisations for the UK, and the United States going down, albeit from a pretty high peak, but a very welcome reduction in the stress in the hospitals in the United States there. But in the UK, I know there's areas where it's still really quite a problem, where it's using a lot of NHS resources, so it must still be bad in the United States. So even though we've got dramatic improvement, it's still really making quite a big dent and impingement on the ordinary care that's still desperately required. So it's still a problem. In terms of the R value, the reproductive value, and that line is R1 there. So let's see where we're at with these countries that we're keeping an eye on at the moment. So just bear in mind that this is the R1 line here. So cases in the United States are below 1, so are still going down. In Canada, they're below 1, so they're still going down. Australia, the United Kingdom, Ireland, Netherlands, and sadly New Zealand got a fairly high R value. Now, you can't take too much of this because it's based on low numbers, so you don't need another dozen cases or so would increase the R value in New Zealand, whereas in the UK it would take many thousands to do that. But interesting sort of trend there. And of course, the big thing is we're currently heading into autumn. This is kind of the biggish unknown really as we head into autumn time. Now, let's look now at just briefly some news from the United States. This is about the Moderna booster vaccines. Now, I think it's fair to say this is a pretty contentious issue, really. So the CDC hasn't said anything yet, that hasn't adjudicated, but the Food and Drug Administration, their specialist independent advisory panel. Now, I don't know who's in this and how independent it is, but their advisory panel has unanimously voted to give booster doses to people who've had the Moderna vaccine, which of course is a big chunk of the people in the United States. 65 and older, and for adults who are at high risk of severe illness, and that'll probably be extended to people with occupational risk as well, after 6 months, and they've recommended a half dose. So it is going to be a lower dose. Now, I do kind of like this because I always like to give the lowest possible dose for the best therapeutic, or in this case, best prophylactic effect. So that's kind of good. The thing that's a bit concerning is Jacqueline Miller, head of Moderna's infectious diseases therapeutic area. So Moderna are presenting lots of data indicating why a third dose is necessary. Now, no one is saying there's anything wrong with this data, but of course, many of us have difficulty forgetting that the Pfizer and the Moderna vaccine are both making the companies a lot of money. These are both for-profit vaccines. But nevertheless, we'll look at what they're saying. 6 to 8 months after vaccination, antibody levels dropped in vaccinated recipients. Well, yes, we know that. And after half a booster dose, this was a study of, I think it was just a study of 300 patients from what I remember. Half-dose booster at least 6 months after initial vaccination restored antibody levels. Well, it would do. But we've noticed before that antibody levels are not really a very good indicator of immunity levels. It's much better to consider the memory cells, the memory T cells, the killer cells, the helper cells, and the memory B cells that are probably more important in the longevity, or I would say are more important in the longevity of the immune response. So you kind of get the idea that the impression that attention is being focused on one particular aspect of immunity, whereas immunity is a spectrum of responses. The natural killer cells, of course. We now know that there's a specific response in the natural killer cells as well. This isn't mentioned. It's simply antibodies. And of course, we know that antibodies wane over time anyway. That's pretty well known. So that's not surprising. And they also say that people from the original trial, there's a clear uptake in breakthrough infections. That's infections after the vaccine in July and August, because they had the vaccines earlier. Now, that is more convincing data there, but if people are actually getting infections, but we believe that protection against hospitalisation and severe illness and death remains remarkably strong. So I think there's still a question mark over that in the States. We'll see which way the FDA jumps officially, but then, of course, the CDC will have to verify that. And within the next, we're probably going to get a decision on this in the next few days, and then hopefully there'll be some sort of decision on the Johnson & Johnson vaccine soon. This is still not decided upon. So they've decided on the booster pattern for the Pfizer, and now the Moderna has been recommended. So that is where we are at the moment. Now, I'm going to move on to the UK now, because we have a remarkably high number of cases. Office for National Statistics data here. Weekend of the 9th of October, people that had COVID-19 in the week, in other words, the prevalence. In England, it was up. In Wales, it was up. In Northern Ireland, it was up. In Scotland, thankfully, it was down, but up in all of these other 3 countries. Now, England, the prevalence was 1.63%. That's 1 in 60 people. Wales, it was 1 in 45 people. Northern Ireland, 1 in 120 people. And Scotland, it was down to 1, if it was higher the week before, 1 in 80 people. So pretty high percentages of people here, particularly in Wales, 1 in 45 people. So over 2% of people there actually infected in that week. High prevalence figures indeed, and we'll look at some of the implications of this. Now, people testing positive for antibodies in the UK as a whole, 93.6%. So we can see that it seems fairly obvious that people, well, we don't know this, but it looks likely that people that are testing positive for antibodies are also getting the infection. So reinforcing the idea that antibodies is only one aspect of infection that we need to, one aspect of immunity we need to look at. Now, Office for National Statistics has also started talking about mortality displacement. Interesting concept. Mortality displacements did not offset excess deaths by mid-2021. Let's look at what they mean about that. So they say there's some evidence of mortality displacement during the pandemic, of course. So this is when vulnerable people die sooner than expected, basically. So a lot of the people that have died of COVID would have died in the next days, weeks, months, or year or two after that. So that is certainly true, because it's vulnerable people and older people that have died. And if a lot of people die all of a sudden in the early stages, as happened in some of the waves, this can potentially lead to a lower than average period of mortality after that. So you can have a higher period of mortality for a period of time, followed by a lower period of mortality. But what's the balance between that? What does it equal, the balance between that? Well, these periods of below average mortality did not offset the high numbers of deaths since the beginning of the pandemic. In other words, there has been excess deaths. So they're taking the 3rd of January 2020 to the 2nd of July 2021. So that's what? That's 18 months of data, isn't it? That's a lot of data. And they've calculated 97,981 excess deaths in England and Wales, compared to what had been expected in a non-pandemic year. Now, this doesn't tell us if a lot of these people that died would have died the year after or the year after. What would be much more useful to know is the years of useful life lost. Now, I don't know anyone that's done that calculation yet, but clearly someone that dies in their 80s, if they die when they're 82, well, they could have died when they were 84 anyway, so they're losing less life than someone who dies at a younger period of time. That would be a much more useful calculation. Never seen it done, never seen a paper on it, but I suspect it will come in time. We'll keep an eye out for that. So within 28 days of a positive test, it's 138,000 have died so far as of today. That's as of the 15th of October. On the death certificates, 161,000. But it looks like quite a few of these then were displaced deaths. And the real figure is nearer to 98,000 excess deaths. People that would be alive now had it not been for COVID-19. Whereas quite a few of these would have died already, and quite a few of these would have died already because they are mortality displacement. So I don't know if that's good news or bad news. It's just an observation really, but I think it does show that a lot of people that died would have died anyway, but they did die sooner, which of course is still bad. Now let's look at some of the Zoe symptom tracker data now. So on this first graph, we see the number of new symptomatic cases. Now, this is the total number of cases here. So we see there's about, 70,000 people per day there in total. But of those, pretty well 19,000, about 19,000 there have been doubly vaccinated. So we see there's about 19,000 people that are doubly vaccinated that are still getting symptomatic infection every day. Now, this does look a bit disappointing, but when we remember that I think it's 78.8% of the population now have been doubly vaccinated over the age of 12. We see that actually, although there's about 70,000 people here altogether, so about 50,000 of these, that from there to there is occurring in the minority and 20% of the population that are unvaccinated. So we are seeing a significant effect of protection there of the vaccines against symptomatic infection, even although 19,000 people are getting infected every day who have been doubly vaccinated. Now this is the incidence by age group. So this blue one at the top here is basically school-age children, 0 to 18, and that was going up, of course, as the schools go back. Starting to go down now, which is good to see. But this is probably not the fact. I don't think this is the effect of vaccination. It's too early. This is more the effect of a community immunity, I think. There's not enough of this group have been vaccinated. But what we do see is that this group appears to have been transmitting the infection to this group. Now, this group here is the 35 to 55, which, of course, is their parents' generation. So this generation here seems to have been transmitting it to this generation there. And the problem is now, will this generation here transmit it to their parents, to these children's grandparents, in the older age group that are much more vulnerable to severe illness and hospitalisation? And that is the risk at the moment. Prevalence by region. We actually see that Wales is still high but starting to go down. This green line here is the Midlands, which is going up. Now, this green line here for the Midlands is increasing, and these are a concern because these are areas of low vaccination. So, for example, Peterborough and Leicester, 59% of the population only doubly vaccinated. Birmingham, I think it's only 55. Manchester's about the same, 54 in Manchester, I think. Low vaccinated areas, but these are areas with high ethnic minority populations, which have suffered particularly in previous waves. So there is a risk for these populations that don't seem to be taking up the vaccine as readily. They are more prone to hospitalisation, severe illness and indeed death in the autumn, when we are expecting more cases in unvaccinated people. And the other concern is long COVID here. A bit more on long COVID in a minute, but well over 1,000 people a day developing long COVID, as after the previous surge. So some pretty interesting data there from the Zoe COVID symptom tracker app, which is always useful. So they're the links for that. I always post the links. Long COVID, we said we were concerned about. Now this is from the Office for National Statistics. An estimated 1.1 million people in the UK currently experiencing some degree of long COVID. That's a lot of people. 1.17% of the population were experiencing self-reporting long COVID. This is still high. Up from the previous week, where it was under 1 million. Now, of the number that currently have it here, of this 1.1 million, 77% had or suspected they had COVID-19 at least 12 weeks previously. So here it's gone on for 12 weeks. So people basically unwell for 3 months after the infection, but 37% of the total had or suspected they had COVID-19 at least 1 year previously. So over 400,000 people in England and Wales have had problems for a year or more now. And this has got obvious implications for the individuals and indeed for national productivity. People that said symptoms adversely affected the day-to-day activity of around 2/3 of the 1.1 million, and these figures are probably going to be the same in the United States or anywhere else. So this is a big burden of morbidity, and basically we don't know which way this is going to go. Are these people going to remain unwell for another few weeks or another few years or another few decades? We don't know yet. This still remains to be seen. Fatigue is the most common symptom. 56% of the 1.1 million get fatigue. Shortness of breath, 40% get that. Loss of smell or taste, 32%. Difficulty concentrating, 31%. They're the main features. So talking about this high incidence altogether, let's just look at, before we look at Tim Spector, let's just look at that actually. The way things are going in the UK, it's not looking good. So people testing positive up 11.5% on the week, deaths up 5% on the week, patients admitted to hospital also up on the week. So we are seeing this and it's consistent between the Zoe COVID symptom tracker app and the official figures, roughly the same indication. So Tim Spector's saying this: UK seems to be slowly waking up to the fact that COVID-19 cases are too high, but the reality is they've been soaring for months and many countries have put us on their red list. So Tim's not particularly happy, as am I. Infections remain high in young people and looking to be spilling over into the 35 to 55-year-olds, as we said, the parents' generation. And if these creep over into the over 55s, now these are Tim's words, could spell disaster for the NHS this winter. So no question that if the infection's gone, we know the infection's gone from children to parents. If it goes from parents to their parents to grandparents, there are going to be particular problems, particularly in these areas with low vaccination that we've looked at. So there's still another few months of difficulty to come, and likewise in the States, cases could well increase as autumn now encroaches, and it is really getting quite cold and autumnal now. People are getting inside and shutting the doors. Just a quick more look at some UK data. We'll look at the cases in the UK. So as we know, pretty consistent with the COVID symptom tracker data actually. They're still going up. And healthcare is actually creeping up a bit, the number of people in hospital at the moment. 827 patients admitted in the day, over 7,000 people with COVID in hospital, and these are beds that we could really do with for treating people that are on waiting lists. It really is a problem. I think over 5 million people on waiting lists. Deaths, thankfully, not going up dramatically, but still being maintained at not insignificant levels. And with, as we've said, the risk to go up more as autumn approaches. Now, what is happening with herd immunity? Now, in the States, is it that herd immunity is kicking in and cases are going down in the States? We certainly hope that is the case, but we are concerned about autumn. But in terms of herd immunity in the UK, now, again, this is Tim Spector on his latest video saying that, of course, we did think herd immunity would kick in at about 65, 70%, but when with the new, more transmissible variants, basically it seems to keep going up. Tim Spector says it's now a minimum of 85%, but we do know that 78% have been doubly vaccinated now and over 90% have antibodies, so we are probably getting towards it. But Tim says, Professor Spector says, it's with cases so high, it's clear that herd immunity isn't happening. And basically, who could disagree with that, with the figures that we've just seen? So it is disappointing. If you'd said to me that when there's 80% of people doubly vaccinated, about 90% of people single vaccinated, 93 point whatever it was 4%, 94%, 94% of people with antibodies, would we have reached herd immunity? If you'd asked me that 18 months ago, I said, well, of course, but we haven't. Then Tim Spector reinforced his idea about symptoms. These are the latest symptoms that he's getting, still inconsistent with the government guidelines. This is just laughable. Current symptoms in the vaccinated, doubly vaccinated in children: runny nose is the most common, then headache, then sneezing, then sore throat, then cough. Loss of smell or taste is dropped down below the top 5. But this does vary a bit, and that's the official UK site that we've just looked at. So that's a quick sort of sketch of where we are at the moment as we head into autumn. My belief is still basically the same. I do think there's going to be more cases in the States in autumn, certainly in the UK. I think we're going to see an increase in hospitalisations in the UK in autumn, unfortunately. But I really do believe that the herd immunity effect, the community immunity effect, is going to start kicking in by the end of 2021, and that cases will be going down. Even though it's still winter, I'm hopeful that cases will be going down by January, February next year. But we have still got this next few months to get through. And of course, many parts of the world are nowhere near the vaccination levels that we are in the more affluent Western countries. Okay, we'll leave that for today, I think, and thank you for watching.